No more periods. Hooray! Everything else, boo. Welcome to the end, ladies. You've made it. You never have to have a period again. Congratulations. For some women, menopause is exciting. You never have to have a period again. You never have to worry about birth control again. And you're excited to explore this new phase of life. For other women, it's kind of depressing. You're at the end of your childbearing years, and you're wondering what it might be like in this new phase of life with your mind and your body. Whatever your thoughts and feelings about menopause, it's inevitably going to happen, just like death and taxes. So what exactly is menopause? There's a lot of terminology out there, and it can be rather confusing. But the definition of menopause is not having a period for an entire year. After that year mark is up, you're considered postmenopausal. And the years leading up to menopause are called perimenopause. So you're really only in menopause for a year. However, you can have symptoms of menopause during perimenopause, menopause, and the postmenopausal period. And the symptoms are what most women care about. Sometimes those symptoms are more significant during perimenopause. And we have a whole other video on perimenopause, so remember to like this video and subscribe to my channel if you want to catch it. And sometimes the symptoms get worse in the postmenopausal period. And sometimes there are no symptoms whatsoever. So if you're a woman who has never had any symptoms of menopause, you're one of the lucky ones. It's uncommon, but some women do get out of this unscathed. The average age of menopause is 52, but some women go through it as early as their young 40s and some as late as their late 50s. There does seem to be some correlation between family members, so if your mom and her mom both went into menopause in, say, their late 40s, it's likely you will too, although it's not guaranteed. Once you go through menopause, your ovaries are kaputs. They're still in there, they're just not doing anything for you. So they're not giving you estrogen, progesterone, or testosterone. The lack of estrogen often causes what we call vasomotor symptoms, which are things like hot flashes and night sweats. It can also cause vaginal dryness and mood changes for some women. Other women might experience things like brain fog, joint pain, low libido, weight gain, abdominal fat increase. There are a lot of symptoms of menopause, but these are just some of the most common. So what do we do about these symptoms? First of all, if you're one of those women who've seen a healthcare provider and been told it's just a natural process, so you may as well just suck it up and get through it, let me assure you that there are many of us healthcare providers out there that can and will help you. So many women feel invalidated by their healthcare providers, but let me assure you that there are those of us out there that really do want to help women with these symptoms. Yeah, menopause is a very natural process. It's guaranteed, just like death and taxes. But you get to ask an accountant to help you with your taxes, so why can't your healthcare provider help you with menopause? Help can come in many different forms, but the most common form is hormone replacement therapy, or HRT. For all women, this includes estrogen, and for women who still have a uterus, it also includes progesterone. Some women also choose to replace testosterone. For many women, HRT significantly helps with their vasomotor symptoms. It helps them sleep better. It helps them feel less fatigued. It can help with joint pain, and sometimes it can help with libido. HRT does not directly cause weight loss, however. But for women who feel better overall and have more energy, it's likely that you're able to make better and healthier choices, so you may be exercising more or eating better, which can indirectly lead to weight loss. As I mentioned, HRT can at times help libido, especially if you're replacing testosterone. However, libido is a many-faceted animal, and we're going to go over it very thoroughly in a different video. HRT comes in many forms. There are pills, patches, rings, creams, IUDs, vaginal suppositories, pellets. Lots of women use different forms of HRT, and your healthcare provider can help you determine which one is best for you. Most commonly, women use a patch for estrogen and an oral pill for progesterone. There are some risks associated with HRT, and the data is constantly changing. Most recently, the biggest concern was that estrogen and progesterone would increase your risk of breast cancer. However, these days, the data actually suggests that if you start HRT early enough, it might actually decrease your risk of breast cancer. When they look at the studies of women who only use estrogen and not progesterone, they found that there's no statistical increase in the amount of breast cancer. However, we used to use a form of progesterone that they do think might have been linked to breast cancer, and now we're using one called micronized progesterone, and that has no link to breast cancer. Quick side note, however, if you are a breast cancer survivor, you should definitely talk to your oncologist before starting HRT. Estrogen, when used orally, can have an increased risk of stroke and blood clots. However, if we use it in all the different forms besides the oral form, there is actually no increased risk of that. We also thought that there might have been an increased risk of heart attack with estrogen, but we found that if we start estrogen early enough, we actually don't increase our risk of heart attack. But if we start estrogen over 10 years after menopause, there does seem to be an increased risk of heart attack. Testosterone has some risks as well and can at times increase cholesterol levels and liver enzymes. Your healthcare provider should review the risks and benefits of HRT as well as your specific health history and goals. In general, there are very few people who it is absolutely contraindicated to start HRT. Ultimately, like I said, it's a risk-benefit situation. So while sometimes HRT comes along with risks, for most people, the benefit of feeling better, having more energy, having better relationships is worth the risks. And for people who feel better, their lives are usually going to be healthier and longer lasting overall. Plus, estrogen use significantly decreases your risk of osteoporosis. So that's a huge benefit. As I mentioned before, estrogen is primarily what makes us feel better. But if you have a uterus, you also need to be taking progesterone. Progesterone in and of itself doesn't really do a whole lot. Some people feel like maybe it makes them sleep a little bit better, but really what progesterone is used for is uterine protection against uterine cancer, which is also known as endometrial cancer. So estrogen in our bodies increases the thickness of the lining of the uterus, and progesterone thins that lining out. And so we need a balance of estrogen and progesterone if we still have a uterus to keep that lining thin so that it doesn't build up and cause endometrial cancer. And speaking of endometrial cancer, if you ever have postmenopausal bleeding, regardless of whether you are on HRT or you are not, you need to seek care immediately. Postmenopausal bleeding is the #1 symptom of endometrial cancer. But maybe you're not a candidate for estrogen, or you simply don't want to take it. There are other options out there. There are a lot of supplements that people take to help with their vasomotor symptoms, and I go over these in depth in the perimenopause video. There are also antidepressants that can help with these vasomotor symptoms, which seems kind of weird, but when studied in an off-label use, many antidepressants actually help reduce women's vasomotor symptoms, regardless of whether or not you're having depressive symptoms. There is also a new medication called Veozah that's on the market, and the FDA just approved it as a non-hormonal option for vasomotor symptoms like hot flashes and night sweats. As I mentioned before, one of the symptoms of menopause is vaginal dryness. The drop of estrogen causes the vagina to be less lubricated and less moisturized, and to ultimately get smaller and smaller and smaller over time, which is called atrophy. This happens especially if you're not using your vagina, so use it or lose it, ladies. Vaginas that atrophy often lead to painful intercourse, and for some can lead to an increased number of urinary tract infections as well as vaginal infections. To treat vaginal dryness and atrophy, most women use a vaginal estrogen, and you can sometimes use both systemic HRT and a vaginal estrogen if you're needing a little extra help. Vaginal estrogen is low dose and very little of it gets systemic, so we don't worry about it the same way we do for systemic estrogen. There are very, very few people who can't have vaginal estrogen. It comes in creams, pills, suppositories, and rings, and it's usually pretty quickly effective. Most women tell me that they're feeling relief within a couple of weeks. But for those of you who may not want to use vaginal estrogen or can't use vaginal estrogen, there is a supplement called hyaluronic acid, which we typically use for our skincare regimen, but when used in the vagina can lead to extra lubrication and moisture. These are not prescription, so I put a link in the description for you to check out the Bonafide website, which has a great supplement of hyaluronic acid. Now, this is just a quick introduction into menopause and HRT. So if you have questions or comments or want to share your story, make sure to leave them in the comment section. But remember, I am not here to give you medical advice. So if you want to know more about HRT and whether it's right for you, make sure to make an appointment with your healthcare provider. And if you want to learn more about perimenopause and libido, check out my other videos. That's it, everybody. Thanks for listening and stay healthy.